As nations around the world race to find ways to combat COVID-19, many are struggling to secure the necessary tools and alternative solutions needed to fight the spread of this disease. For many weeks now, here in the United States, the country has faced challenges in securing the much-needed COVID-19 test kits and has had to request shipments from several countries such as South Korea. When tests are administered, the Center for Disease Control and Prevention says that as of March 26, COVID-19 tests would take up to 7 days before generating results. Meanwhile, experts around the world continue to predict that major catastrophes from COVID-19 could take place in Africa due to the state of health infrastructures in many nations. However, countries around Africa are rising to the challenge of fighting this disease as they have done in the past against major outbreaks such as Ebola and HIV, to name a few. Here on Our Voices, we have noticed an upsurge in locally manufactured tools that may be the game changers in the fight against this current epidemic. In today's episode, we highlight several impressive innovations as well as alternative solutions being produced by Africans to solve Africa's unique challenges. Welcome to the conversation. This is Our Voices. As usual, I'm joined by my colleagues, Ayen Bior.
Hi, Ayen.
And Haiti Adams Fitzpatrick.
Hello there, everyone.
And on this special edition, they will also share with us innovations that have caught their eyes lately. Ladies, could you tease us a little bit about which innovations have caught your attentions in the continent of Africa lately? Ayen?
Well, Ayen, we know that soap and disinfectant are the best ways to fight the coronavirus. Later on in the program, I'll introduce you to a new initiative in Kenya that is helping to get these products into people's hands.
Thank you. How about you, Haiti?
Well, we're also going to take you to South Africa now. Usually, everyone these days is looking for more information about COVID-19, and that usually means people are looking down onto their phones. But a mayor in the municipality of Tzaneen in Limpopo province in South Africa is telling people, if you want to find out more information, look up to the sky. And he's got a message there for people. We're going to share that with you a little later on.
Awesome. Thank you, ladies. But first, before we go to South Africa and to Kenya, let's go to Senegal. Very soon, COVID-19 test kits may be the least of their worries, as plans are underway to mass-produce test kits that will cost less than $1 and generate results in less than 10 minutes. According to researchers at the NGO Institut Pasteur working on this innovation, it's a very simple rapid diagnosis test which will be similar to one used several years ago on diagnosing Ebola. Amadou Sall, director of the Institut Pasteur in Dakar, tells the media that the idea is to rapidly produce millions of kits, not just for Senegal, but for African countries, so that patients can be detected and isolated quickly. Before we leave Senegal, the country has begun clinical trials of the COVID organic remedy dominating much of Africa's headline and promoted by Madagascar's president, Andry Rajoelina, as a cure for COVID-19. Senegal plans to use this remedy in the country in both a preventative and a curative means. This was recently announced in local media by the Senegalese Health Ministry on April 7, but the World Health Organization cautions the use of any traditional remedies without proper testings. However, in West Africa, it's not just Senegal showing interest. A number of African countries in the Economic Community of West African States, ECOWAS, have all received and thanked the Malagasy's president for sending them shipments of this remedy. ECOWAS, however, distanced itself from claims that the region has ordered the consignment of COVID organics remedy from Madagascar. Professor Stanley Okolo, the Director General of the West African Health Organization, an organ of the ECOWAS, spoke to our colleague James Barty and had this to say.
We believe in traditional medicine. We promote traditional medicine. We have identified, nurtured, and actually continue to promote and sponsor, to some degree, supported centers of excellence in traditional medicine across the West Africa region. And in fact, one of those centers of excellence that we have supported previously is researching on some medicinal plants that we think may be active against COVID-19, but it needs scientific investigation.
Nevertheless, Madagascar's Institute for Research says that sufficient scientific trials have been conducted. More on this, Raissa Loussouf reports for Madagascar.
I'm in Antananarivo, the Malagasy capital, which hosts the Malagasy Institute for Applied Research. It's the organization producing COVID organics, a herbal tea presented by the Malagasy government as a remedy for COVID-19. So I spoke to Rafatu Erinsu, who is a scientist at IMRA, and he told me that testing for COVID organics started around a month ago here in Madagascar. A dozen patients received the COVID organics treatment, and among them, at least 2 people recovered from the COVID-19 disease thanks to the product, according to IMRA. There are 2 types of treatment. There is one to cure, which is given to patients in hospital. And there is one treatment to prevent the disease, and it's used also to boost the immune system. So now IMRA wants to patent their products, and that's why they are keeping the secret of their ingredients. But because of that secrecy, they did not receive market authorization, which means they cannot sell the products to other countries. But the Malagasy government did grant a temporary authorization, which is why the products has been in supermarkets here in Madagascar. It means that it cannot be considered a drug, but rather an improved traditional remedy.
It seems to be stirring up a lot globally as well as, of course, on the continent. And ladies, what do you think? Haiti, what do you think?
Look, Ariane, I can understand what continental pride it would instill on people across the continent if a cure for COVID-19 would come from home soil. I personally would love to see that, and I think many other people on the continent would agree. I don't think anyone in terms of African leadership right now is dismissing what Madagascar is offering here and what Madagascar is offering as a cure. I have not seen the evidence yet, scientific or otherwise, that someone who has been infected drinks the juice and then is cured. And I'm also not seeing a lot of full-blown support from the entire medical and scientific community on the continent. And many African leaders. Now, of course, I know there are African leaders who are supporting this, but I'm very curious about those who are not coming forward and saying we endorse this. Even the African Union, and a statement it released on its website, is asking for more scientific data. They want more information from Antananarivo to know how effective COVID organics really is and how safe it is. And so there is a lot of reticence on the continent too. And I can understand from leaders like, for instance, Cyril Ramaphosa in South Africa in his capacity as the AU, but also in his capacity as the president of a country where not too long ago people were told that if they eat more garlic and potatoes, HIV will not touch them. What did happen was South Africa ended up with the highest HIV infection rate in the world, and people were not given access to antiretrovirals. So I am always very, very reticent when a cure comes from politicians and it doesn't really come from either the scientific or the medical community or from the traditional leaders community. In South Africa, traditional healers play a very important role in public health policy. They are brought to the table. I don't know to what extent that's happening now, but I've not even seen that from many such organizations and associations. Again, I could be wrong. People are still reacting to this, but that's just my take. I am just concerned that it is being bandied about as a cure.
Yeah, I can understand for sure, but let's look at it. I mean, people on the continent, and I would say actually majority, if not most of the people in the rural area, if you say to them that everything that they will take to heal themselves and to get rid of sickness and disease must go through a sophisticated scientific process, they would dismiss that notion. I remember being young in Burundi when I was a city child, but every summer my parents would have us go into the village where they grew up so that we can have that village experience. And I remember vividly getting very sick and having stomach problems, and my grandmother going on her fence and ripping up some herbs and some kind of green herbs, and she washed it and made some juice out of it, very, very bitter juice. But once I took it, 10 seconds later, I was like almost revived. And so this is what people are used to doing, and they're used to finding solution through herbs and things that grow in the earth. And so it's easy to see how they're embracing it. In terms of coverage, I have seen a pretty good amount of coverage on African websites, African news organizations that are actually covering this, because as you have mentioned, I believe more than 10 presidents have actually met with the president of Madagascar, trying to understand, trying to see exactly what this remedy is about. And so I believe that we should not dismiss the remedies, just as the members of ECOWAS are saying, we should definitely support remedies that could be, a solution.
Ariane, I think that the worry is that this is a new virus. And from what we have heard from epidemiologists, from virologists, and from doctors all across Africa, is that this will take a new way to fight this new virus. I do agree with you, and I do take heart in knowing that us as Africans, we have traditionally used herbs and natural remedies to fight illnesses. And the plant that COVID organics is based from is called artemisia. And artemisia has been around for a very long time. It was traditionally introduced as a way to fight malaria. So I take great comfort knowing that this tea from Madagascar is not going to have any side effects that we know of. I do take concern in the language that's used around COVID organics when people say that it could cure COVID-19, when people say that it could prevent COVID-19. I think that language can be very dangerous because we are talking about a virus that can kill people. And I'm also concerned at the lack of reporting around COVID-19. I haven't heard from patients who have survived because of COVID-19. I haven't heard any of that. I think that we don't understand how Madagascar conducted the experiments. We don't know if the placebo was used. I would certainly love to know that. Mm-hmm. And I think that Madagascar could alleviate the tension behind COVID organics if it shared, how they did it. And I don't think that Africans, like Katie said, I don't think that Africans are coming from a position of trying to prove them wrong. I think that we're just trying to protect ourselves and our community who has been given false hope before. So I think that that's where we're coming from as a community. Natural herbs are great, but when we're talking about the coronavirus and we're talking about a new virus, I think that it deserves to be looked at from a new lens as well.
Yeah, definitely. I mean, this have just recently been announced, so we have yet to see a lot, we have yet to hear a lot, and we have yet to be proven, as you've mentioned about it being shipped in the different countries. As we've heard earlier, the shipments are not being sold because they are actually part of the remedies that isn't being disclosed, and so it's not up for sales yet. I think that whether it be the international community that is looking for the proof, it should go to Madagascar and ask Madagascar to provide the proof. But saying that it needs to be done on an international level, it's almost sounding as if the international community needs to take over this and research it on its own and then approve it. I believe that Madagascar itself should be the one to provide the proof with their own scientists. And we're going to end the conversation there. We would like to hear from you what you think about this COVID organics or any alternative solution, as well as innovations on the continent. Catch us on Facebook, Twitter, or Instagram. Our handle is at VOA Our Voices, or on WhatsApp. Our number is on your screen. We'll be right back.
Being part of Our Voices is about more than just sitting here and talking about women's issues. It's about listening to them
and bringing their opinions to the table and making sure their voices are heard.
Because our lived experiences, our stories, and our voices will help shape the next generation.
Welcome back. You're with Our Voices. A huge concern in the fight against the coronavirus is protecting frontline healthcare workers like nurses and doctors who care for COVID-19 patients. Doctors in Johannesburg might have a solution. Here's my report on a new innovation that is helping to prevent COVID-19 infections in an intensive care unit in Johannesburg.
Take a look at this. It's called the Into Box, and it was designed by 4 South African doctors to protect healthcare workers in the intensive care unit.
The Intubox was designed by the Charlotte Hospital emergency team. We looked at what was existing on the market and found that there was very simple square box with 2 holes, and we tried it and wasn't really effective in terms of what we felt we needed to do with it.
The Into Box is made of plexiglass with holes so that doctors can safely assist COVID-19 patients.
The idea is that this box will create a seal around the patient so that whatever further procedures are needed will happen inside the box. For example, if you have to suction down the tube, you have to disconnect the patient from the ventilator, and if they cough, that's a very dangerous thing for staff. So by ensuring that all of that occurs inside the box, you're actually isolating the patient in a container. The virus cannot spread to your other patients, it cannot spread to your staff, so everybody is more protected than they would usually be.
Doctors here hope this new design will help hospital staff take care of COVID-19 patients while giving healthcare workers an extra layer of protection.
From South Africa, we go to Kenya, where a group of companies have come together to help prevent the spread of the coronavirus. I spoke to the creators behind Safe Hands Kenya to find out how they're doing just that.
We are only now really starting to ramp up what it is that we want to do. And just to be clear, our mandate is really around the protection of people in the informal settlements who would tend to be those who are most at risk should we have the kind of scale of infection that we have seen in other countries. So these are people who cannot change their lifestyle, they cannot do social distancing, they have to go out and about every day to look for work, to feed their families. So things like lockdowns won't work. So we were thinking, what is it that we can do to help these people out, specifically from the sanitation perspective? So this was provide these people in these informal settlements with soap, with sanitizer, with masks, and surface disinfectant that we would use with different teams to disinfect public spaces. So these are like marketplaces, places where we have public transport coming together, and those kind of spots. So those are the 4 main pillars that we were trying to address.
It was only a matter of weeks before the virus entered Kenya from Western countries. Could you talk to me about the process of seeing how fast the news around COVID-19 was developing and how quickly your team had to move to try to beat it?
Sure. So, I mean, one of the things is that many people of this team of the coalition companies are actually involved in these informal settlements, providing services or products really to the end user grassroots level in these informal settlements. So they are very close to seeing the impact it could have if people started getting sick in these communities. So very quickly, I think one of the first things that happened is that a couple of the CEOs of these companies came together and thought, who is it that we can involve in this thing? Who can make decisions quickly? So decisions had to be made locally, or at least people being able to commit resources and people. And by resources, we're not just talking about money, we also talk about skills. So Safe Hands Kenya itself is a pretty small office. We are only 3, you could say, kind of employees, contract employees of Safe Hands Kenya. And the rest are they're seconded by our coalition members. So these are people who are able to help us think through a lot of the logistics, the planning, sourcing, all the different aspects that would, bring this whole thing together. And then also run pilots. That's what we have been doing for the last 3-4 weeks. So trying to ensure that we are not just dumping stuff, making sure that these products that we provide the communities are able to have the desired impact. We are able to generate messaging, behavioral change messaging that will, go with these products, so that will help people change the way they do things and realize that they themselves are the cure to the spread of COVID.
What have you learned so far in your position?
First and foremost, there's a lot of misinformation out there. People not being aware of, what COVID actually is and how it is spread. The products that they have, for example, just simple bar soap, its effectiveness in cleaning hands is probably just as good, if not better, than sanitizer. And then changing people's behavior so that they are not also putting other people at risk, especially what we know now as almost a fact that the elderly tend to be more at risk of COVID than people below a certain age. So not going to visit your grandparents, your mom, your pops, just ensuring that you're able to manage the spread. Apart from that, I think one of the most positive learnings has been how much people want to help. We as Safe Hands Kenya, we are not working alone. We have found ourselves in the middle of a huge number of people wanting to do things for all Kenyans.
Thanks, Ayen. We have to take a quick break, and when we come back, Haiti Adams Fitzpatrick will take us to South Africa, where a mayor of a town is telling people who are used to looking down on their phone for COVID-19 information to look up to the sky. We'll be right back.
You're with Our Voices. Welcome back. In South Africa's Limpopo province, in the northern parts of the country, people are being told to not look down on their phones if they want more information about COVID-19, but to look up to the sky. Officials there are using drone technology to spread their messages about COVID-19. Marisa de Klerk has the story.
COVID-19 has changed many things in South Africa. Here, in the Greater Tsenin municipality of South Africa's northern Limpopo province, the mayor's voice comes from a drone in the sky, warning about the potentially vital virus. With only 3 hospitals in the entire district, extensive coronavirus prevention efforts are needed, says Mayor Maripi Mangena.
We are able to access our people. A drone is a fact that it's not a very common technology that is being used. I think it's part of the 4th industrial revolution. But how we are using it, when it flies, when it hovers above the communities, it fascinates, it intrigues people. People want to listen. People want to hear. What is the message that is being said?
A licensed drone service provider is carrying out the messaging at potential coronavirus hotspots under the direction of the South African Police and with the guidance of the municipality's COVID-19 committee. The Greater Tsenin municipality was originally the only jurisdiction willing to use drones from NTIYISO Aviation Services, says company managing director Jack Shilubana.
They've got the perception that we're talking about the whole lot of money that you spend in this exercise, and others would probably ask to say, but why don't you provide water? And it is that balancing act, in terms of how much drone technology costs you, but the value that you derive from an exercise such as this one.
Drones are well suited for this purpose in rural areas, especially in Africa, because they provide more value for the money spent, says the head of South Africa's Federation of Unmanned Aircraft Systems, Sam Twala.
In Africa, that's where drones are going to find better use compared to even other areas in the world or other countries in the West, simply because of that particular challenge that we might have. And when it comes to things like your cost, that's where actually drones add much more value, because drones offer that advantage where you can tactically, place your people.
It seems that the spreading of the message about COVID-19 prevention has helped in the Tsenin region, says a local journalist.
I believe it helped. And I believe that without the drones broadcasting these messages to the people in the far-off areas, they wouldn't have known.
So far, just one case of coronavirus infection has been reported in the Greater Tsenin municipality. Marisa de Klerk for VOA News, Johannesburg, South Africa.
Another interesting innovation is in Uganda. Through an app called Market Garden, backed by a local NGO, Institute for Social Transformation, women vendors in markets around Kampala are receiving grocery orders and sending them directly to their customers at home via motorcycles. A mode of transportation locally known as a boda boda, once normally known for being busy transporting people around town, now dropping groceries from vendors from door to door. Take a look.
When an order comes to the Market Garden app, I get a notification, I accept it, I call the customer that I've received the order. Then I call the boda boda guy to alert him that I've received the order. Then I start gathering the items. After that, I call the boda boda guy to come and to deliver the items. Then I give him the location and the contact of the customer.
COVID-19 has helped us adapt new methods of working. For example, we've been able to use the Market Garden app, whereby we've been able to get new customers who cannot reach the market. This has helped us increase on our sales income. We do use boda bodas to deliver our goods to our customers because they cannot reach the market. Then the other thing, we always receive some messages from our customers in form of appreciation, indicating that we are doing good services to them.
Very impressive. Well, we'll have to end it there, and I want to thank my co-host, Ayen Bior, and Haiti Adams Fitzpatrick for being with us, and all our guests today. Thank you.